All right, very good. So the first thing to look at is your instrument. So this is a needle holder. Put your index about here, middle finger here, and then you work it up. And typically we want the suture about 15 centimeters. I'm using a PDS suture. So the first goal is to grab a little far from the tip of the needle, or the back of the needle rather, so it can actually move around like this. And this allows it to go through the port easy. And then I'm going to use a Hunter grasper. If you notice, I don't put my entire thumb inside the Hunter grasper. It's just easier to do it exactly how you would do in open surgery. You can get used to this. And we have a model on the inside of an artificial small bowel, and we're gonna suture first with the model side to side like this, simulating a jejunostomy. And then the next step is, the more difficult step is, you'll have the model situated vertically. So this is situated horizontally. If you have the model situated vertically, you'd actually simulate what a gastrojejunostomy would be. So the first thing you want to do is to learn how to load and unload the needle. So there are many ways. This is one very easy way. You grab underneath the tip of the needle and you can move it around in any direction you want. Then you can load. So I want to load again. I want to grab underneath the tip. Then I'll use the suture to put it in the direction I want. If I want to backhand, if I want to forehand. So I think this is the first step you need to learn. You drop everything up, then you go grab the suture, grab underneath the tip of the needle, then you can load. So this is the first step to get used to, is to get used to loading and unloading easy with the needle. And make sure that you have it loaded, so when you drive through the tissue, you drive appropriately. So this is the first step. So you want to spend as much time doing this step until you get used to the depth perception. Once you do this, we're going to start from 12 o'clock to do a posterior layer all the way to 6 o'clock, and then come anteriorly, stop here, then start a second anterior layer. So we'll use 2 sutures to create a 1-layer anastomosis. So again, I'm going to grab underneath the needle. I'm going to point the needle towards me, so you can point the needle different directions, towards 9 o'clock, towards 6 o'clock, towards 10 o'clock. So I'm pointing it a little bit lower so I can get the top. So I'm going to lock this needle holder, and I want to go find the corner. So this is the corner. If I'm having difficulty, you want to grab just underneath where you're going to take the bite. So this is exactly where I'm going to take the bite. I'm going to take a good bite with the tissue, so you can see I'm not through the mucosa yet. So now I'm through mucosa. I'm going to grab the needle itself. I'm going to steady the tissue, because if you don't, you'll pull it out. And then I'm going to load again. You always want your needle to be in your view. Now I'm going to go again, grab the other side. This is my corner suture. So one of the most important things is you always have to put corner sutures. So now to pull the suture, best way is I'm going to grab the suture with my left hand. I'm going to steady my right hand just like we would do in open surgery. I'm going to pull my left hand outside the port. It doesn't matter how much I pull, as long as the port is a 12 millimeter port. And now once I have the appropriate length on the short suture, I'm going to go back, let go of the needle. Not going to bring it back so it's in my way. And I want to grab not at the tip of my left hand, but rather past point. And I always want to identify where's my short suture so I can see it there. And then the knot is thrown with the tips of the instruments coming near each other. So again, not grabbing at the tip, it's coming at 12 o'clock. And to throw the knot is a left-handed motion, if you see. So this is something that's subtle, and I think I'm going to make this a little longer. Most people think when you're throwing a knot, you're doing the movement with your right hand. The reality is you're actually steadying your right hand, and your left hand is doing the suturing motion. It's very subtle, and because most people are not comfortable using their non-dominant hand, that's why you struggle at the beginning. So you need to get used to using your non-dominant hand. So I grab the suture, I'm going to come out of the loop, and then I'm going to steady my right hand and pull my left hand outside the port. This tightens and keeps a short tail. Then next, I just need to bring my left hand back to the middle. Now I'm ready to throw a knot the other way. So if you see, it's all about staying near the tips of the instruments together, and I'm going to move the left hand. So the motion is not the right hand motion. The right hand is going to stay in its place. It's the left hand that's doing the work. So if you're right hand dominant, most people are, suturing is difficult at the beginning because you need to get used to using your left hand. So I'm going to repeat this a couple of times just to see it again. Bring my left hand back. And while I'm doing this left hand motion, I'm not pulling back a lot. It's just a very fine motion. And the slower you are at the beginning, the better it is. So you want to do it slow enough until you can actually perfect it, and then speed will come. So now this is my first knot. So now I'm going to load again. So to load, grab the suture, find the needle, go grab it underneath the tip, use the suture to move the needle around. At the beginning, you will notice that the depth perception in the sim lab is actually worse than the OR. That's actually a good thing, because by the time you get used to doing it here, you come to the OR, it's much easier. So I've locked my needle. I'm going to go, and I'm going to go find where's my last suture, move things around. So you can see this is the last knot. I'm going to go through here, go grab the other side. And this model actually is a pretty realistic model. The bowel, you could see clearly mucosa, you could see clearly serosa. So again, steady things. So if it didn't come out, I dropped it. So I'm going to go back and grab it. All right, so again, just like I showed you earlier, I'm going to grab this suture with my left hand. I'm going to pull and steady that hand back. Pull my left hand as if it's coming outside the port. If I need to tighten, I can take these sutures, tighten them apart. And then I come back again and load again. And now I'm just going to repeat this over and over until the posterior layer is done. The nice thing about this is once you finish, you're actually able to take the model out and examine your own anastomosis. So number one, first step is to be able to complete the task. Once you complete the task, second step is you look at how long it took you to complete the task, which is like the next iteration, third iteration. And then the last step is to look at the integrity and make sure, actually the second step is integrity, last step is time. So again, I'm going to load one more time. And I'm going to ask them to get me a different needle holder because I think this one is not as good. So maybe the same type of needle holder, just a different one. I'm going to try a different one. So you can see now, every time I go to the tissue, grab with my left hand, pull until I get that posterior layer done. And I'm not pulling on the tissue, you see, I'm pulling on the suture itself. Okay, so every time I go in, identify the tissue, go take a bite, grab it with my left hand. If it doesn't come out, I can go still grab it with the right hand like that. Come out, and again, every time I grab the suture, steady the tissue, and pull. So I'm gonna exchange that to the other needle. Thank you, the other needle holder. Yeah, I think this one feels better already. All right, perfect. So again, the repetition is number one, learning how to load easily. That's one, I'm loading. Number two is trying to focus on rather than time, focus on just being able to do it. So now I'm coming close to the corner, you can see. not at the corner. The more I supinate my hand, just like in open surgery, the more the needle pops up for me, so I can grab it. So now again, grab the suture, pull back, and now if you can see, my posterior layer is done. So you can see it here. So I'm going to stop here. I'm going to stop the recording, so at least this is a video of how to create the posterior layer, and the person could actually look at it over and over, and you can actually look at the posterior layer from underneath. It looks pretty good. So let's stop the video there, and this will be the first video of how to create the posterior layer. The second step will be to run this corner and come to the anterior layer, and then actually maybe I should just do that, and then we'll stop the video. So we'll stop the video after we turn the corner, so at least the person could actually do that. So because we will need 2 sutures to do this anastomosis. So this is now the first suture. So if you notice now, I need to turn the needle to allow me to turn the corner. So again, same way to load. I'm going to grab underneath that tip. We'll grab the needle. Now I want to see exactly, so I am inside here, so I'm going to come inside out on this side, and this is a modified canal stitch. So in a canal stitch you have to go always outside in, inside out, outside in. I'll show you, this is a modified canal stitch. So I am now outside on this side here, so I'm going to grab, try to come out. Okay, it's underneath there. Alright. Once you're outside, you think of these 2 pieces of bowel as if they're 2 houses with a tunnel in between them. So if you're inside, you can go to the other side through the tunnel. But if you're outside, you have to cross the street. So I'm crossing now to go outside in. This is the modified canal. And you have to steady the bowel. And as you're doing this, you want to watch how you're standing. You want to make sure your elbows are not flaring. You want to make sure you're standing in a comfortable position as you're working. And you want to be patient. You can see I went outside in. But just like I said, these 2 houses have a tunnel. So here I can immediately go inside out on the other side. So you can do this with your left hand, or you can turn the needle around like that. And I'm going to go, because I'm on inside on the left side, I can immediately go inside on this side here. So I'm going to go inside out on this side, and now I'm going to tighten. I try to tighten at the same time, so I'm going to tighten always when I am on the outside. Again, steady the tissue, grab here. You can see we're starting slowly to kind of turn the corner. You always want to feel it getting tight, okay? So now I want to load backwards. I'm going to load the needle backwards. I lock the needle to make it easy for me. Go grab the tissue here. And I'm going to go inside out. And as I said, the 2 houses have a tunnel, but the 2 houses, once you're outside one house, you have to actually cross the street. So you go from one to the other on the outside. So you cross. Now, because I am on the inside, I can immediately go on the inside on the other side. You could do it with your left hand. You could do it with your right hand. It doesn't matter. So again, I'm trying to stay same distance from the tip. I'm trying to stay same distance, like same bite distance. And you just do it visually. You can see. Over time, you'll get, every time you examine it, you'll look better. So now this will be the end of the first video. So I took a layer from 12 o'clock. I went past 6 o'clock. I am now anteriorly. So I completely cross. I'm going to show you how it looks posteriorly. You can see it there, and tighten it more. You can tighten it more like that. So now the posterior layer is done, and I came anteriorly. And now I'm going to, in the next video, I'll take an anterior layer, start from where exactly I stopped, and then complete the anterior layer. So let's stop the video there and maybe take a look at it, see how it looks. Perfect. So now we have done the posterior layer. And now we're going to do the anterior layer. Now, in a patient, you will have to do 2 layers because there's tension. Here, there is no tension, so if you just do 1 layer, it gets the idea. But in patients, in general, we do 2 layers. So now, this is the first layer, and I'm going to use the suture to my advantage. See if I can pull with it like this so I can see the edge. And I want to make sure I can get the corner. All right, so I just steady the tissue there. I'm going to grab, and I want to make sure I can get the corner. So I got the corner. You can do it in 1 or you can do it in 2. So if I'm going to do it in 1. So now I've assured myself that I've gotten the corner. Again, pull the needle out. Keep it in view because there are other structures. Could be the liver, could be the IVC. Now I pull with that left hand until I have a short tail. Once I have a short tail, I grab with my right hand. Remember what I told you? You pass point. You don't grab at the tip. And again, you steady yourself, and your goal is to work with that left hand. And if you find this too short, like I'm finding, just adjust. It's a small adjustment you do at the beginning, and over time you get experience. What people do is they pull with that left hand. You see, when I pull, it's not easy to do. So you always keep that left hand. You don't want to pull it back. You see, the loop disappears when you pull back. So you always keep your hand not up here, but near the area where the knot is going to come, and you don't pull back. It's just a circular motion. You're circling around that tip. Once you do that, you go with your right hand, grab at the tip of the suture, pull out, steady the right hand, and pull only with the left hand outside the port. Now I bring my left hand back, and every time I just do that circle. Now you could ask a question, is every knot you're doing square? You could square every knot, but if you put 3-4 knots, like we've not had problems. But you could, if you want, square every knot by switching your hands, and I'll show you what I mean. So once I come out like this, I could square the knot like that. This is a square knot now. And the next one the same way. Once I come around the area, grab the suture, I just cross my hands, it will become a square knot. All right. So now one last, and then I'm gonna move to the anterior layer. And typically we cut these sutures so they don't confuse you if you do in 2 layers, but in 1 layer it's not a big deal. So now I'm gonna look at it. You can see it looks good. So now all what I have to do is just run this suture to meet the last suture I had on this side. So I'm gonna try to load again. So this is one other way to load, but the way I want you to learn is grab underneath the needle, move the suture around, make sure you're happy with it, lock yourself, and then you can grab just next to where you're going to take the bite. You have to twist your wrist exactly how you do in open surgery. Laparoscopic suturing is no different than open suturing. And then I go grab the needle, come out of the tissue, grab the suture, and then I'm going to pull only with the left hand, steady the tissue so it stays in its place. And as I said earlier, if you want to tighten, you can pull them apart. You can see now we're on the home stretch to try to get to this needle on this side. So again, I'm going to go in, grab next one, I'm going to take the bite, twist my wrist back, take a good bite here, go on the other side, grab, another bite, follow the curve of the needle, grab the suture, give it to my left hand, then tighten by pulling the left hand outside the port. Make sure it's nice and tight. One way to load, if you get experienced over time, is just to do this. So in surgery, that's all what I do. I don't every time go grab, but at the beginning, it's better to learn by grabbing underneath the tip. So you can see I need to travel a little bit. So visually, you can see exactly how you're doing. Again, pull out, and you'll notice the more you do this, you'll kind of get into a rhythm and a flow of working. So you can see by tightening, you can tighten the last 2 layers. Now I'll bring my left hand back, steady the needle down, and I can load the next time, like that. Now 2-3 bites and I'll be done with the anastomosis. And at the beginning, it doesn't matter if this takes you half an hour, 45 minutes, even an hour. It doesn't matter. What's important is that you're able to do it appropriately. When you finish, you're able to actually examine your anastomosis. While you're working, the bowel doesn't get out of the Velcro. That's important. If the bowel gets out of the Velcro, that means if you've situated it well at the beginning, you're pulling too hard. You don't want to put this much tension on the bowel. So now here, because I'm close to the end, I could actually use the suture itself to allow me to take smaller bites. You can see we have 2 more bites and we're going to come to the end. And then we'll examine our anastomosis and see if it looks good. And what's important when you examine it is, you know and you get feedback. How did you do? Was the anterior layer the problem? Were you not pulling the sutures hard enough? Was the posterior layer the problem? Was the corner the problem? And then you can adjust. So the next iteration when you do it, you can just turn the bowel around, and that allows you to do another anastomosis. So each piece of bowel you have, you could attach this to this and just turn it around and do the other side. And it's like fresh. And sometimes even if there's needle bites, if you cut it, you can do it again. So now the last bite is going to come on this side, and I'm going to get a scissor, cut 1 needle, and then I'm going to tie them to each other. So now this is the last one. Follow the needle. You can see, and always you want to cut the suture that is shorter. That looks good. I'm happy with it. So I'm going to cut this one. So in order to cut and to just remove things in one, you have to think about it. If I cut here, I can remove the needle right away. If I cut here, I'm going to have to grab the needle again. So you always cut, so it's just one motion inside the patient to remove the needle. All right, so now I can remove the needle right away. So you think about where you're going to cut before you cut. So now comes to tying the last part, and then we will examine our anastomosis. So again, grab the suture first, give it to your left hand, don't grab at the tip, pass point. This is a very important thing. Then again, I don't pull back, I stay close to this, and I'm gonna, let me see if I'm grabbing this well. For some reason there's 2 loops here. Okay, perfect, like that. It's better, excellent. So now I'm gonna go around once, the left hand, allow me to go the second time. Keep the hands together. See how my left hand is following me? And now I'm gonna try to tie this. So now this is the first knot. And I'm gonna tighten it, make sure it's nice and tight. All right, grab again. So this is a very good exercise for intracorporeal suturing, and if you come regularly every week, do this exercise, you'll come to the OR every time way more comfortable than the time before. I've done this with trainees for years, and trainees who come and do this, spend the time in the lab, they see great improvement when they come to the OR. They're less stressed because you've worked on your own here. Okay, so now the last thing is I'm going to cut this suture, and then we're going to examine the anastomosis. And I'm going to try to examine it on the screen first, just to show you how it looks. And then after that, we'll try to examine it outside. So this is now the entire anastomosis completed. So this is a 1-layered anastomosis using 2 sutures. In the OR, to create a gastrojejunostomy, we actually use 2 sutures. So I'm gonna take the Velcro off, just to show it to you inside here. Okay, so I'm gonna take the other Velcro off. Trying to protect the bowel, not to injure it. Okay, perfect. All right, so now you can see this is the back of the anastomosis. I'll show it to you better. So this is the back of the anastomosis. You can see it, so you examine it. So you can see this area here, it's not as good. Maybe next time when I do it, I'm going to pay attention to this more. But the rest of it looks pretty good. So this is how you create a side-to-side anastomosis with 2 sutures, 1 layered anastomosis, and then to create a gastrojejunostomy type anastomosis, it has to sit. I'll show you how it will sit. It will sit like this. It's the only difference. And when it sits like this, the angles of the needle are more difficult. So you want to first practice in the side-to-side, and then you can make this end-to-end next. Okay, I'm going to stop there, and then the next video will be 2 more videos to show you how to do this simulated like a gastrojejunostomy. All right, thank you.